Hello, everyone, and welcome to another episode of the MyAdvice podcast. My name's Chad Erickson, and I'm the Vice President of Strategy at MyAdvice. And it is my pleasure to welcome you here today. And I'm excited. Our topic today is going to be really it's the 2024 outlook. And here we are at the beginning of this year. Still the beginning. We're almost Valentine's Day, but still there's a lot of this year left, and a lot of things are figured out to figure out. With me today is Mara Shorr. Mara is a dear friend, a highly respected consultant in the aesthetic space. I've known Mara for the better part of a decade. We've been on many speaking panels together. We've known each other for a long time. And she is, as mentioned, well respected within the space. And she brings a very unique and extensive background to our conversation today. And recently, she joined up with a group that I've known for a long time. And so I'll let her talk about sort of that transition with Brunson Anderson. It's a great consulting firm, and she can talk about that a little bit more. But Mara, tell our audience a little bit more about you and your background and some of your expertise. I think they need to hear it directly from you.
Yes, thank you so much. Thank you so much for that intro. And I can't believe that we've known each other for a decade at this point, and it is such a wonderful friendship. Side note, if anyone ever wants a really great book recommendation, Chad is the one to go to for that. So that is always something over every one of our conversations. We always have a great takeaway with that. So my name is Mara Shorr, and I am now with Brunson Anderson. I am just absolutely thrilled to be consulting with them, but I have been consulting in the aesthetic cosmetic plastic surgery space for 12 years now, which is wild to realize that when you turn around and your career in this particular industry is that long. And so I have been consulting in the industry for that long, really across North America. So I've had clients across North America. So I personally am located here in Orlando with my husband, some fur babies, and an ever-growing modern family, as we typically do things here. But like I said, I focus on in the consulting space, this particular industry. And on the operational, administrative, financial health of a practice is really where I focus, but I love all things processes and protocols. So I really love processes and protocols for all aspect of a business. If I could toot my own horn, I have won several awards for practice management in the past, both from Aesthetic Everything and also I've won from the Aesthetic Show and the Aesthetic Guide as well. So I'm also part of a textbook author, which I always somehow manage to forget about. And Amy goes, "No, you should really boast about that."
Really?
So
Yes. It's huge.
Amy Anderson of Princeton Anderson, which I was thrilled to write. And I'll tell you the fun part, Chad, is that we wrote it and submitted it either right before or during COVID. It was published, and then I am now starting to hear people say, "Oh, yes, no, I own that book." And I go, "Wait a minute. I
Gosh.
forget that there's actually a lot of people in the industry now that own The Business of Plastic Surgery Volume 2. So I do have a co-authored textbook chapter out there. So that is a little bit about me, but really I consult with practices across North America, really in the United States, and absolutely love it. I'm the one to come to if you want to get your hands dirty and get in the weeds and you want a good checklist, all while being very compliant.
I love it. And we're going to talk a lot about your expertise today, systems, processes, because I've got some really good questions for you about that. And I think it's critical that the groups we talk about today understand those and why it's so valuable to them. As we get talking, and Mara, thanks so much for that, for really expanding upon that. I always get bored when I start to read someone's bio. I'm like, oh my gosh, this falls so flat. I love when people just talk and introduce themselves. It just feels so much more natural. So thank you for doing that.
And you told me to expand, so I only did exactly what you
Yes, and
asked,
I
right?
love it. That's exactly what I want. We
Thank
keep this
you.
very informative and conversational, and
Yes.
in a place where our audience can really connect. As we think about this year, honestly, things are really picking up again. I see some really strong signs in the marketplace. People I'm talking to are feeling it as well in a good way, which is awesome. But let's talk about for some of these practices, what are the top three challenges? You talk to practices every single day. What are the top three challenges that they are still running into every day, and how do we help them?
So let's see. Okay, we're gonna keep track of this because I feel like I could go well beyond three, but we're gonna work on sticking to three,
Okay.
right? That's what we're gonna work on today.
If
So
there's a three plus in there, we'll let it go.
okay. So one of the top I would say is HR, right? They
Okay.
are struggling, and we're going to just use HR as the umbrella, but within HR, hiring is still a massive issue that all practices are struggling with. And whether that is hiring the right team or managing the right team, which so really I think everything falls into one or the other, hiring tends to be something that is still very, very difficult. And I see a lot of reasons for that. COVID, the era of 2020 and 2021, it showed a lot of employees that they were disposable, and it made a lot of people that feel that they were very disposable. And
Mm.
in that, loyalty to the companies, I don't want to say went out the window, but went out the window. And so people think, and whether this is what they should be thinking or not, but really standing up for themselves and saying, I'm going to take back what I want in a position from the employee standpoint. And so with that, it's almost that we found a lot of overcompensation on that end, not financial compensation, but overcompensation, because we're finding a lot of people that are not qualified for the position that think they very much are qualified for the position. So we're having trouble finding qualified candidates again for a period at the end of, I would say, end of 2020, beginning of 2021. This was not an issue. We had a whole beautiful pool of candidates that unfortunately have been let go. And
Mm.
so there were more candidates than there were openings. And then it switched back. So we are now in the other end. We are finding with a lot of positions that when I'm interviewing, of which I'm doing a lot right now for clients. So I go in and I help them with their interview process from start to finish, and we're getting so many no-shows despite getting reminders, despite the candidate
Interesting.
being despite and the candidate will literally make their own appointment and then not show up for it sometimes 23 hours later. And I'm seeing this happen a lot. So we that's something that we continue to struggle with. So there is that. It's not that there's a lack of really qualified candidates, but there's just we're not getting to them at this point and they're not getting to us. So that's something. And then on the other component to that, I'll say number two. We're going to go on number two,
Okay. Number two.
which yes, number two, which also goes a little bit into number one with when I talk about HR, but with people, we want to make sure that they have their processes in place. And so I see that we're still working with clients that are floundering with having the right processes in place and having everything either written down or having a video tutorial for everything in the practice. Because if we know that there's going to be growth and we know that there's going to be turnover, of which I've seen a lot of right now, our clients, the ones that are opening new practices, we know that there's going to be growth. And if they're going through it with turnover, we know that we could probably expect more. So why not detail everything in writing? Or if it's technology, something that's at a computer, having something for video, really, then we want those processes and protocols to be to be recorded, to be written down. But I'm seeing that a lot of times that just isn't happening. And so you're either starting all over again, and I'm still seeing this where they're starting all over again when a team member joins, or we're going off of things that were done the same way 10 years ago. And we shouldn't be running a practice like we were 10 years ago because there's so many really
Hmm.
cool tools to run a practice now. And you and I can spend an entire other conversation geeking out on those, and we have.
Totally. We have, yes.
We love a good tool. We love good technology. So, and that's where really I would say the third is I see practices underutilizing technology, that either the technology that is already included in their EMR software, in their lead tracking software, where they're just not taking the time to learn what comes with it, or they're not contacting their reps. I always recommend once a quarter to every 6 months, contact your rep if you're not hearing from them when it comes to technology, and just ask to put a meeting on the calendar. Say, give me 30 minutes and tell me what is it that the updates for this software are, right? Because you may not know it. as the practice. You may not know what software updates have come out in the past 6 months to software you're already paying for. So I say that's a big one. And looking at either free or very reasonably priced software and making sure you have full knowledge of how to really utilize it and how it can work for you, because it's 2024. We should not be designing
Yes.
things in a Word document or in PowerPoint. We should be using, if not Photoshop, we should be using Canva. I don't get paid by Canva, but I just love Canva so much. I say it's design software for non-designers. Use the pro version, pay the $15 a month or 100 and some
Right.
dollars a year. It's so worth it. Look at how something like ChatGPT can be assisting in making your work. It's going to cut your work time in half when it comes to anything that involves writing things down.
Yep.
And looking at the guidelines associated with that. So, I mean, we look at how are we really utilizing software to its fullest potential. So those are the three.
I love it. And I couldn't agree more. And it really kind of leads into the next question I wanted to ask you. I think all three of these apply to it, which is about, how do you help a practice become scalable? And I think it's pretty much all three of those, isn't it?
It is. I think it's all three. I think it's learning how to, number one, you have to have the right framework in place to start with. So you have to know where you are and where you're starting from to know where to grow. So I think that includes, number one, like I say, it's the processes and the protocols, and know what you're doing now, right? Because sometimes I see it where not only do they not have it written down, but one team member doesn't know what the other team member does. The owner or the practice manager can't tell you what everybody does on their team because they're just running so fast. So I think that's part of it, because it's hard to course correct if you don't know where you are, and it's hard to expand on it if you don't know where you are. The other part is knowing your financials. So you need to know where you are now and then know how to grow from there, because you either want to look at what are you overpaying for, or what is happening to, for example, leads that are coming into the practice. Are we converting those leads? And if we aren't converting those leads to a consult, why? If we aren't converting them from a consult to a treatment, why? If they're not coming back, why? But when we talk about scale, those are the biggest opportunities for improvement that I see on a daily basis, is patient retention and conversion of leads.
Those are huge. So I hope everybody wrote those down.
Mm-hmm.
Patient retention and conversion of leads. And thinking about a sales flow, it's a funnel, right? We think about this all the time. Obviously, this is our world. We live in it. But it's like, okay, a lead in, then what's the next step? What's the next step? And how do we respond to those? How quickly do we get back to them? How do we stay in touch with them? And it's all about retention, and keep them and
Yes,
keep them coming back. And I think that you nailed it. I think those are the quick wins. The HR elements of the hiring, the sustainability, those are hard. They're necessary, and they're going to be a big part of this scale,
correct.
but they're not the quick wins. The quick wins are, what can you do with your software? What are you evaluating? What are you doing with your metrics, and how do you look at those numbers? And how do you make sure you're aligned with those and on your financials, and you even I think another part of it is, um, are we profitable? Sometimes, oh, we made all these and these treatments, but how many times, Mara, have you looked at somebody's, financials, and they're basically losing money because they're doing,
Yes.
too many of one type of procedure that actually doesn't
Mhm.
make them money.
Right.
You're laughing, right?
I laugh because I've seen it. I've seen it, or we have the patient in one time and they don't come back, and we never. So we're constantly looking for a new patient, right? And we're spending money to get that new patient. And I see this where it's either they're performing treatments that are loss leaders, and a loss leader to a degree is okay if it leads to that patient sticking in the practice, right? That's
Right.
that's the goal of a loss leader. But if we are not keeping them in the practice, then that's just a loss.
Yeah.
That's just we
Right.
we lost the leader component of that. So that's a really big part of it, is looking at that. And when we work with a patient, And when a practice works with a patient, especially if we're looking at something that is ongoing, right? So maybe not necessarily a breast augmentation that's typically going to be a one-time procedure. But if we have, especially as we look at other wellness programs now that a lot of our practices are involved in, and we look at your patients, when we bring patients in, we want a baseline. We want to know, where are you now? We want that patient data. Where is that patient now? And let's get a baseline. As a practice, you need to know your business's baseline health. So where do you stand today? And then we look at, where do you stand? We looked at, where do you stand today? What did it look like for the past 3 months? What did the next 3 months look like? What did the past 3 years look like? We are finally at a point where we can go back to looking at the past 3 years, because for a little while, we had just said, we're just going to eliminate 2020. We're just going to pretend. We're not even looking at 2020 data, especially depends on where the practice exists, because some practices were closed down far longer than others. So we're at a point now that we can look at the past 3 years, but we need to look at the data and the baseline, just like we would when treating a patient.
Makes a lot of sense. Mara, as you go in as a consultant and they're opening their books to you, how do you find that delicate balance of telling them that their baby's ugly?
I mean, this is Chad, you're asking someone that literally tells her dog how handsome he is on a regular basis.
And Mara, I know you would never do that. You're like one of the kindest people I know. But to my point, it's you sometimes get in and people are like, they think it's going great. Obviously, they want to hire you. And the only reason they're going to hire somebody is because they feel like that person they're hiring is going to help them be better, right? And that's the goal. So that's got to be a challenge, though, right? Of where they think something's good, and when you actually help them understand the data behind it, it can look a little ugly.
It can. And I was taught that really the data is king, right? So the data is what is the most important. And it's very, very true. It's hard to argue with the data, which is why when you sit down and look at the data, and I don't like to anecdotally hear from a practice, oh no, we're doing great financially, but we want to work on these other 4 areas. So I do want to get a sense when I work with a practice there, I do want to get a sense of where they do stand financially, because that's also going to dictate their ability to give raises to their team, their ability to hire a new team. Do they need to raise price points for current procedures because they haven't done so in 7 years? So we need to look at those things as well. Some practices still take insurance. And so we need to look at, are they getting, what does insurance reimbursements look like? And are they currently on a current schedule, or have they not negotiated those reimbursements? And we have clients that we looked back and said, "Ooh, it's been 6, 7 years since that's been renegotiated." So we look at these things because the financials are what is going to help with the rest of the practice, what we can and cannot afford. Are we able to, like we said, are we able to give raises to team members as well? So I think with that, I say that you want to look at the data, and we want to, I like to show and have open and honest conversations with the practice once I've brought the data to a point that is very understandable, because I want to make sure. And for different practices, it's different levels. There are some doctors that say, I want to look at the raw data. I want to analyze it myself. I just didn't know what spreadsheet I needed or how to pull it. Some that say, no, just give me that summary and we can just have a quick meeting about the summary, quick, loose definition of quick. But it depends on who I'm speaking with. But to bring that data is incredibly important. Did you know that you're only bringing in X amount of money per month as a net versus a gross, because these expenses are so high? Did you know that you are now paying this amount in biomedical hazardous waste because you haven't renegotiated the contract? It's gone on auto renew. And so it continues to increase at this astronomical rate. Did you know that every payment that you receive from a patient on a credit card, right, is taking out this high percentage rate? And so let's use that to have a conversation and negotiation with your bank or whoever is processing your credit cards.
Yep.
Or B, let's have a conversation of how we're supposed to handle this and what do we want to do with this. So there's so many conversations that those numbers help guide, but the way that I tell somebody that their baby is ugly is with the facts, because it's hard to argue with the facts. And if we're
Yes.
running up with an HR issue, right? Well, have you have you actually, do you have an HR folder, right? And do you have in writing all the
Yeah.
time that this employee was late? Do you have everything documented for the time that they came in not in their uniform and you had to send them home, or the times that they, called out sick, or the time that they caused a fight, or the time that they did XYZ? Do we have this all documented? No. Well, now it's just we need to start documenting these things so
Right.
that we can actually utilize this. So I say bring all the data, and that's what we look at, because the data is the best way to say, not tell them that their baby is ugly, but show them that their baby could use some work.
Yeah, there you go. And that's a better way to put it. We with what we do, and this is one of our core values at My Advice, is we have four, but one of them is called intellectual honesty. And when I first heard that term, I didn't quite understand it, and
Mhm.
had to kind of explore it. And somebody had mentioned to me, like, that's actually really powerful, because honesty can have what's honest to one person is different for another person, the way that they interpret it. But intellectual honesty gets rid of
Mhm.
the, as you mentioned, anecdotal elements. It removes the emotion, and now we're down to the facts. And here's the
Yes.
data. And either the data is going to say this or this. And yeah, somebody can say, well, how you interpret the data. Okay, fine. But the data is still going to be the data. And we
Right.
can go back and forth and we can disagree on how to interpret it. But there's a few things that are standard. Here's your revenue. Here's your EBITDA. Here's your net profit, right? What are those things? Um, and what's your margins on various
Hmm.
services or products that you offer?
Hmm.
Which of your expenses could be reduced
Hmm.
to allow you to increase that EBITDA? And then you talk about, getting into the raises. If you're doing things right, all of a sudden you avoid this vicious cycle of having to let somebody go or they quit to now I got to train them again. Now it's a pain. Now we're starting to hum and then they're gone. And it's like, no, actually they're here. We might have a little upset or something goes on, but also, hey, they're getting a raise, they're kicking butt, and it's a line. It's not gonna be a straight line, but you're growing, and so you think about it as in a
Hmm.
linear perspective, because there's culture, there's goals, there's a scalable solution. They feel like they're part of
Yes.
a company, as opposed to having their hair on fire all the time. And when you can avoid that mentality within a business, because it feels like this is sustainable, we're process driven, people feel that they need a sense of comfort. And that's a big part of it. So
Yes. So much. And
that's, yeah,
you and I have had so many conversations about
tons.
workplace culture over the years and how it's shifted, because
Mhm.
it's what the workplace culture for you and what the workplace culture looked like for me just over the past 10 years that we've known each other has shifted, where there
Tons.
was in person, there was remote, there was hybrid, there was, I mean, and just what people are looking for. And I think that it is incredibly important to recognize the importance of workplace culture. And it's
Yes.
different for every company. So you can't say that this is the only thing that you need with workplace culture, because it's going to be different. The culture at My Advice is probably very different than it would be, and the culture for a laser sales company,
Hmm.
which is very different than the company culture at Brinson Anderson, for
Yes.
example. And that's okay, because the world employs all different types of people. So the person that would be a fit for one wouldn't necessarily be a fit for the other. And that's okay. But you need to really define what your workplace culture is, what's important to you, what's valuable to your business, and make that very clear as well. And not tolerate any less, and nurture everything that you want from your team. And I always say team, because you really do need to think of your company as your team. So that's, I've always felt like that.
There's I couldn't agree more. And make that happen, make it a priority, and you're going to see great things happen. Mark, kind of shifting gears just a little bit. we talked about wanting to talk about some of these things that are happening. I'm just finishing up a conference that happened over the weekend, which has been great. The outlook's awesome. It's been fun to hear some different things. But I want the audience to hear from you. 2024 outlook. What are some of the biggest trends that are plastic surgeons, facial plastics, derms, med spa owners, nurse practitioners? What do they need to be paying attention to right now? What are the trends in 2024 that, boy, you better be on this or you're going to probably miss out?
I think that, we're still, I think as an industry, keeping up with what is going on with the semaglutide, whether it's Ozempic or
Yes.
another brand name. I think just keep an eye on it, because I also, much as I saw with vaginal rejuvenation when it first came into the market, because that's that's how long I've been in the industry, is when it really became more mainstream. There are practices that love that and practices that say this is not at all for me. But I think keep a very close eye on the news surrounding it, approvals surrounding it, and whether or not you think that this is for you as a practice, because I think it's not necessarily for everybody or within everybody's comfort level, and making sure that we are at the appropriate point of entering into the party, not too early into the party, not too late into the party. And so I think that that's really true with anything that comes to market, right? You don't want to be so early that everything isn't tested. You don't want to be so late that the market is fully saturated. So, I think that's a big one. And I continue to see on the more business side of things, the use of AI in really cool, creative ways. And I think that when we talk about trends, we often will talk about treatments, but I think on the business side, continuing to watch the evolution of AI to me is incredibly fascinating, and what else it brings to the table, and keep an eye out for the software that comes to the table and the technologies that are coming to the table as well.
Awesome. I think those are three really good ones. I was at A4M conference at the end of the year. And for those that aren't aware, that's anti-aging wellness. When it gets into some of these sort of
Mm-hmm.
topics
Mm-hmm.
like the wellness and weight loss, they tend to actually be several years ahead of
They
the
do.
normal curve. It's an interesting group to go to. Some of the things might seem a little off the wall, and they're kind of there, then they disappear. Others are there 5 to 10 years before, and next thing you know, it's mainstream, right? It seems a little quacky, and
Yep.
all of a sudden it's mainstream. And so, interesting conference to attend. But
Actually,
there,
Chad, can I add
please,
one more
please,
thing
please,
that I'm seeing?
yes.
And I will say this is more on the anecdotal side, right? That I'm seeing more on the patient side versus necessarily just the practice side. But I think that there was a huge push a few years ago with BHRT. And
Hmm.
then we stopped hearing a lot about it, right? So I think as
Yep.
far as like the new thing, it was just because, and look, every couple of years, or really once a year, there's like a new thing that will come out, whether it's a software or a device or a treatment. And one of the things that I have realized is that women are now becoming more and more comfortable talking amongst their peers about hormonal changes. And there was a period where women weren't as comfortable talking about whether or not they had a breast dog. And now that's much more mainstream. And, or if, women weren't as comfortable talking about if they had a facelift or if they had Botox, and now that's more mainstream. We went through that as women with vaginal rejuvenation, where we were more comfortable. But I think now I've noticed a lot more where women at least are starting to talk amongst each other when it comes to discussing hormones and hormonal changes. And so I think keep an eye on that amongst your patient base, where it's something that people saw for a little while as a fad, if you will, but in reality, women's hormones continue to change. I say this as a woman in her 40s, and so I speak from the patient side, but I've had a lot of really interesting anecdotal conversations. And I think it's really a market that is not being marketed to as much as it really could be, the way that we focus on other things.
Interesting to say that. I'm seeing similar things,
Mm-hmm.
and saw that at A4M conference as well.
Mm-hmm.
With that, if you're curious, I think there's a lot of great resources out there on the Ozempic side, especially with the specialty pharmacies, different ways to
Yes.
do that, save yourself money. Um, Find the local specialty pharmacies that can recreate that for you, and for your patients, and really hone that in the way you want. The AI side, let me just speak to that for just a second. Mara, you and I have had some really great discussions about AI. And for those of you like, I don't get it, it's scary, or I've dabbled a little bit, I don't know, keep spending time with it. I would tell you, if you're not spending at least 15 to 20 minutes researching AI every single day and thinking about how do I get more efficient? Don't think about it as just AI. Think about it from this word, automation. Just think about what tasks are we doing in the office that are medial tasks that we're doing every single day, and how could I automate those tasks? And if
Mhm.
you can't if you can't figure that out, you're going to fall behind. But if you figure that out, that's where you can really, help yourselves. And when you think about these hiring challenges, imagine that you've got the right team on staff, and because you're utilizing automation within your practice, you don't need to hire the next person, and you're not overworking your group. They're working smarter, right? And so now they become more efficient within today's standards. That's where this really needs to be applicable to your business. And the software side of it you mentioned can be a huge portion of that when used right. Now, you can get it in over your head and have too many different, pieces, but working on those and finding the right ones are critical. So I'm with you 100%. I think those are the trends I'm seeing as well. So I love it.
Yes.
Mars, we're kind of wrapping up today, and because this has been phenomenal. This will be my toughest one for you. So good question coming up. But let's be honest, there's a lot of consultants in this space, just like there's a lot of marketing companies. Help our audience understand what differentiates Brinson Anderson. And I've known Amy Anderson for many years. I've
Yeah.
known you for a long time. But what really differentiates Brinson Anderson? Because I guarantee that our audience gets hit up all the time. Every time they go to a conference, there's some consultant. Every device company's like, "Oh, work with our
Mhm.
consultant," and so it can feel confusing of like, because they want to choose the right group.
Mhm.
Tell our group why Brinson Anderson is different. What makes you unique in the marketplace?
Sure, sure. So I would say that we really specialize in two different specialties, if you will. So we have, let's say, two divisions, if we think of it that way. One is the plastic surgery med spa side of things with the cosmetic aesthetic focus. And then the other is orthopedics. I don't work on the orthopedic side. We have a great team that does. I do not work within orthopedics. Never have and don't plan to. That's why I love the team that does. So I think number one, you want to work with a team that focuses within our space, because I've heard people that come to me and practices that come to me and say, well, I've looked at other consultants and they're business consultants, but they've never worked in our industry before. There's such a difference between a consultant currently working within this particular industry, within the aesthetic, cosmetic, plastic surgery space, as versus a business consultant. So you want somebody that really understands, somebody that's able to have the conversations about what it's like day in, day out within a practice, like Chad and I can. So I know, Chad, you're not a consultant, but the way that you've heard Chad and I speak about this is what we see. And really, you also want to know that they're currently working in the space and have been working in the space for some time. So I'm going on 12 years in this industry. So I've seen trends, I've seen what's come and gone, I've watched new things come in, and you want someone that understands that as well. So I think that's a big, big part of it. You want someone that's able to help you with different aspects. And so you also want somebody that's able to say, this project may not be for me, and that's okay, right? Just like
Yeah.
when you have any other, whether it's vendors, whether it's friends, whether it's somebody that you dated in the past, they could be wonderful, but they're just not for you. So I think those are some of the components. And quite honestly, we've worked in practice before. So our team, we have team members that are providers, that they have an esthetician background and they've worked in office before, they've worked in a practice before. Some of our team members come from a hospital setting and had gone to private practice, and now they're in consulting. Some of us have been in consulting for a very long time, like me and like Amy and Cheyenne. And so we really want, that's what you want in a team member. And I also say look for those different facets. I also think it's quite honestly important that you work with a consultant that you can relate to and you feel comfortable with. So there's not one consultant that's out for everybody, and that's okay. Just like anybody else, I say the same thing, and I say this even with website companies, where it's, you want that conversation to go well, and that's really, really important. So it's okay to have multiple conversations, and we have multiple team members to work with. It's not just necessarily one person or another person. We have multiple team members.
I love it. And thank you. And I think it is, you have to excuse me, find the right fit.
I hear
And
you.
so I think that what Mara talks about is so critical. You and having a team that can scale with you as well, that knows the industry, knows the space, has been there and done that. And so if you're looking for somebody and they would like to get hold of you, Mara, to just talk and maybe get a feel for whether or not you are the right fit, how would they reach out to you?
Yes. So my email is Mara, MARA, at brinsonanderson.com. And Chad, I think you said that you'll put the
We're going to
email
put it
address
up
in the
here on the
show
screen so
notes,
everybody can
right?
see it here. Yeah, they'll be
Perfect.
able to see
So
it. And
it'll be up there. So Mara at brinsonanderson.com. So you can find me on Instagram at Mara Shorr. You're going to see helpful tips and tricks for running the practice. You'll also see my foster dog, and that's the aspect of my life. Chad sees both. So
I do, and I love it.
we and I'm on LinkedIn as well. So those are all the different ways that you can find me. You can also go to our website, brinsonanderson.com.
Awesome. Mara, thanks again. And to our audience who are listening and watching
Thank you,
today,
Chad.
you're my pleasure. Thank you for joining us. Thank you for everyone listening. We are here to help you, and we hope that you feel that every single time you participate on our podcast and listen, wherever you might be. We wish you all the best in growing and sustaining your business, and we look forward to talking to you on our next episode. Take care, everyone.
Yes. Thank
Bye
you.
bye.